Hi, I'm Dr. A.B. Mendelson. We're here today to talk about endoscopic tracheal shaves. So endoscopic tracheal shave surgery is a novel approach to a very important aspect of gender affirming care. Tracheal shave is the surgery which removes an Adam's apple. There's really, apart from genitalia, no more gender dominant area of our bodies than the Adam's apple. We only see it in males. And unfortunately, there are a lot of females there that have Adam's apple. It just has no business being in there. We're very fortunate that the Adam's apple is completely useless. It's cartilage, but it's not important in any bodily function. However, it is part of the voice box or the larynx. We can very safely remove that Adam's apple and get that neck contour exactly the way it should be. So traditional tracheal shave required an incision either directly on top of the Adam's apple or just above to try to hide the incision. But either way, our trans patients were faced with a really horrible decision, either living with the Adam's apple or living with the potential scar, which can be just as outing and risk clocking and other types of hatred. And it was an area that wasn't being well treated. And so approximately 4 years ago, we developed a technique which allows us to get down to the Adam's apple with cameras so that we can see and understand the anatomy, take care of the tracheal shave surgery in the best way possible, and then come out with the camera, come out with our instruments, and leave the only incision site hidden within the mouth. For endoscopic tracheal shave, done under general anesthesia, it takes about 60 to 90 minutes. And when the patient's sleeping, what we're going to do is gently pull down the lower lip. And on the very bottom of that lower lip, we'll make it a cut about an inch and a half, right between the two canine teeth. What we do is we can lift up the soft tissue of the chin, go up and over and down to the Adam's apple. We do this with a camera or an endoscope, and so we can make sure to keep everything safe, including all the structures and muscles in the neck, as well as the throat itself. Once we get down to the cartilage, we're able to basically clip away the excessive cartilage, making sure that we're not going to go too far and clip away the attachment of the vocal cords. And so once we're able to maximize the amount of cartilage that we're able to reduce, we'll go ahead and wash out the area, come on out, put some absorbable stitches along that incision site, and send the patient on home. From a recovery standpoint, while the patients are going home the same day, I recommend at least a week off of school or work. There is some discomfort, and just as importantly, there's some swelling underneath the area of the chin, as it's our route to get down to the Adam's apple. But very quickly, patients are coming back to their normal lives. There can be some tenderness or pain when swallowing for the first week, but overall, there's really not a lot of restrictions that are required. So what makes our approach special is that, as opposed to a cosmetic surgeon, here at Lucento we are performing the tracheal shaves by a larynx or voice box specialist. This allows us to be very aggressive, but safety is first, and making sure we preserve the vocal cords. So tracheal shave surgery is done under general anesthesia. So during the procedure, there's going to be no pain. After the surgery, again, usually I give a couple nights worth of some prescription pain medication, very quickly transitioning to things like Tylenol and Advil, and overall we can expect about a week of discomfort. So to prepare for tracheal shave surgery, first importantly, I want you to maintain on your hormone replacement therapy. There's no need to stop that. You gotta stay off of all tobacco-related products, smoking or anything else. Even vaping will decrease your wound healing. And lastly is just to prepare the night before, no blood thinners, and find a ride to the surgery center. Because we're using the camera to make sure that we keep patients safe and ultimately make sure that there is no scars left behind, we do see that increases the cost and the time required for surgery, and so sometimes a shared cost model is required from some patients.